Hello everybody, my name is Clinton Carter and I'm a student at Arkansas State University and I'm working towards my master's in social work. And so this is a presentation for crisis intervention class with Dr. Rebecca Evans, and I chose my subject to do my presentation on substance abuse crisis intervention models. And I chose substance abuse because the reason I got into social work and what fueled my passion to want to help other people is my past and things that I've been able to overcome with the help of people that are in social work, and just by being led and taught by other people how to overcome certain obstacles. So for this presentation, the crisis I'm going to present is, first off, I'm going to go ahead and just kind of show you a little what the slides are going to kind of look like. And anyways, so it's the substance abuse crisis intervention models, and then as you go up, I've got a little quote here, okay? And the quote, it says, "Your choices you make could have a great impact on an individual. Making the correct choice is what decides if the impact is a positive impact." And I say that because in crisis intervention situations, especially having to do with substance abuse, being in our rural area in northeastern Arkansas, the main thing that I see is crystal meth. And so when you run into a crisis situation, the person is usually erratic, may have been awake for days, so may be hallucinating. Whatever the situation is, they're not in their correct state of mind. And often as therapists or case managers, QBHPs, we try to put ourselves in the shoes of the client or the patient that we're dealing with. And when it comes to substance abuse, this is a hard thing to put yourself in someone else's shoes unless you've actually been there, and that's true with a lot of situations. But I say that because I have been there, and so your mind is not thinking clearly or logically, and so it's kind of hard to even put yourself in someone else's shoes if they're not thinking logically or clearly. How are you supposed to even comprehend what they're thinking? So anyways, I think it takes a certain person with a set of skills, and then also some evidence and different things that have been tried in order to make the right decision. I do think with substance abuse crisis intervention, it is a decision that's going to have to be made when you meet the person there on the spot. So let me move on. And so what I want to talk about first is the crisis situation. So an uncle of a 28-year-old female calls in a frantic panic state on Easter of 2020, and he explains that he has his niece in the vehicle, and she's 28 years old and has a crystal meth addiction and is freaking out, is erratic, and he wants to know where he can take her to drop her off in order to get her help. Where can he bring her to? And he's calling me because I am the executive director over a faith-based 9-month inpatient facility. So anyways, in a situation like that, as a real life situation, what is it that we should do, and what is it that other people have found works, or what models are they using, and is there a better way? So with this situation, I'll tell you how we dealt with it towards the end of the presentation. I'm going to move on though. And so when you first come into a crisis situation like this, I'm going to give you the 7-stage crisis intervention model. And this was, I did some reading, I've read about it before in one of our classes, but in one of the journal articles I was researching by Roberts and Yeager in 2005, lays out these 7 stages for this crisis intervention. And so the first thing is to plan and conduct an assessment of the situation. And this assessment could and should include lethality assessment, risk, suicidal, homicidal assessment. And so that's the first thing. You want to plan and conduct an assessment, and it's going to have to be quick in a situation when it comes to do with someone that's unstable, especially whether it be alcohol or opioids or methamphetamine or anything that distorts your mind. The second step is you want to rapidly establish a relationship with that person. That's a huge thing, and I think that takes a special person. So any way that you can find a way to connect with that person to get that relationship, that's going to be number 2. So plan and conduct an assessment, and then 2, establish a relationship. Your third stage and step is going to be to identify the problems in the situation. So what are the main problems, and prioritize them. Number 4 is going to be dealing with feelings and emotions, and so that's going to include active listening and also words of validation back to the person. The 5th step is going to be exploring or coming up with alternatives that can be done with the situation. And then your 6th step is to develop an action plan after assessing all that and getting that, and that's probably going to happen pretty quick. And 7 is going to be to establish and follow up on that action plan. So that's the 7-stage model that has been used and for quite some time and is still used today. These are some models that you're probably, when I start talking about them, you'll understand, you'll have heard of them, or you'll be reminded of a situation, whether it be a TV show or something like that. But the first model, in which is commonly used, I don't use it, but a lot of people do. And the first thing, when I heard intervention in social work, was I thought of the TV show. And so this model is called the Johnson model. And if you've ever seen the TV show Intervention, that's what they use on that show, is the Johnson model, where they get all the family members together, or close friends and family, and a lot of times have them write a letter to the person that they're going to be intervening on, and then they take the person by surprise. They don't tell them the family's waiting, and they bring them into the room, and then they're just kind of bombarded basically. And the goal of it is to basically get them out of their denial when you've got all those people there together, get them out of their denial, and then offer them support and tell them why you care, and offer them usually an ultimatum at that moment. You either take treatment now, or we stop enabling you, or we can't continue to help you until you want to help yourself. And so The Johnson model is used. I don't so much hear of it used a lot around our rural area, but it is something I think that is successful, and I've seen it work. And sometimes people really want help, and so sometimes when they're bombarded like that, it's kind of overwhelming, and they're really crying out for that help. They need it. On the other hand, if it's the wrong type of person, the type of person's probably going to end up feeling pressured when they get bombarded. They're not going to trust the person whoever brought them into the room. They're going to feel like they were sabotaged. They're going to feel ashamed, and they're definitely not going to feel that they're in control of the situation. And that if they don't feel they're in control of the situation when they go into recovery, then there's a bigger chance that they're going to have struggles or relapses in their recovery, to where if they go into the recovery feeling that they're in control of the situation to begin with, they're going to have much better outcomes. So that number one was the Johnson model. So, and then we're going to move on to number two. The intervention was the invitation model. And so the invitation model is a lot like the Johnson model. Like on the TV show Intervention, the only difference is on the invitation model, they take out the surprise. They take out, sabotaging the person and catching them off guard. And so in the invitation model, a close friend or family member would talk to the person that's in the crisis and try to set up a time that they could all meet and talk. And so the situation there is the person has to be ready and willing, because otherwise they're just not going to show up to that meeting if they're not. So anyways, we're going to move on to the third intervention model that's used or has been used a lot. Is called the field model. And this model it's named that because the interventionist is able to make the decisions depending on the situation at hand. So it's a flexible and adaptable intervention for quick situations. Just something that I think is great. I very much like this model, and each situation that I've been involved in is different, and a lot of times things are different depending on the person. There's things that work with a group of people, but there's certain people that they're just different, and you've got to kind of tailor their intervention to that person, and I believe that wholeheartedly. So it's said it's often in the moment of meeting them that you decide your best choice. If you're going to when you first meet that person, you kind of make that decision. Are you going to really put the effort into it, which we should in all situations, in any client we deal with, but unfortunately we don't. So we make that decision when we first meet that person if we're going to put everything forth and go with the best and give it the best treatment that we possibly can, and using the best intervention that we possibly can, which possibly could use a mix of interventions, and so the field model would come in handy. Number 4 is going to be a systematic model. This is a model that brings friends and families to a place, and has the friends and the family emphasize them on playing a role as the encourager and someone that's supporting the addict, and also it even allows the family a time to accept some of the blame that's going on, whether they were enabling throughout this or they turned their head, but somewhere it lets the addict know that the family is involved, that they're willing to accept that they play a part in this. It's not all the person. They don't feel ashamed. That everybody's in this together, and there's a much better outcome when the family plays a role and helps. That way, the person's not alienized, and they realize that everybody's in it together. So I've seen a lot of family support with addicts, and that played a big role in that person staying clean down the road, having that support. It makes a big difference. Number 5 intervention is going to be the motivational interviewing. So this model, it helps the interventionist see and understand things from the addict's point of view, which is a hard thing to do. But the therapist in this model, in this intervention, is more empathetic and listening, and we're more interested in building a relationship with this one. And so after you've given empathy and sympathy, and you've tried to understand or look at it from the addict's point of view, and you start building that relationship, and you're non-judgmental, and once you build a relationship, the client or the patient's more apt to listen to you if you were to come up with some goals. If they don't initiate the goal themselves, if you were to come up with some goals, then once you build a relationship, they're listening. Okay, he's got my best interest in mind, and so he's trying to motivate me and set goals and short goals and day by day, and that way it builds their confidence. So I put a note, this reminds me of something I've read about a reality theory, and really just building that relationship first. That's the main thing, making them feel comfortable so they open up and are more apt to listen to you and changing. So those were the most common models. Also put in here, I came across some other stuff as I was reading journal articles trying to find interventions. There wasn't a lot on substance abuse crisis interventions, and there's not a lot of studies on that, and I can see there's not a lot of people that deal with it. So, but anyway, so I'll come across, it's a new idea, an intervention for addicts or people that are likely to be addicts, and it says SBIRT, or SBIRT in all caps. It's a comprehensive, integrated public health approach to the delivery of early intervention and treatment services for persons with substance abuse disorders, or people that are at a high risk of becoming or having a substance abuse disorder. Primary care centers and hospital emergency rooms, trauma centers, and other community settings, these all are good places that provide opportunities for early intervention with people that are at risk for substance abuse. So screening quickly assesses the severity of the substance use and identifies the appropriate level of treatment. So this is a brief intervention, and it focuses on increasing insight, awareness regarding substance use, and then motivation towards behavioral change. Referral to treatment provides those identified as needed more extensive treatment with access to specialty care. So this is kind of getting ahead of the problem and trying to get to people before they actually even get a substance abuse disorder. Okay, and let's see here. So another article I read, and I thought this was great, and it says no single treatment is appropriate for everyone, and I say amen to that. Treatment varies depending on the type of drug, the characteristics of the patients, and matching treatment settings, interventions, and services to individuals' problems and needs is critical to his or her ultimate success in the long run, in order to return to be productive in society. And I agree with that. So, according to Psychiatry Online, psychiatric services, Crisis service provision at community health centers is also important for several reasons. First, it is a very high need, as indicated by the number of calls to U.S. crisis units, estimated in the millions annually. Second, because of the potential to prevent suicide or harm to others, there is a narrow window of opportunity to intervene in often inadequate alternative sources of crisis care within the community. It's saying that there's just a short window when someone is in one of these crises, and so we need to work on getting someone placed basically in every healthcare facility, have someone placed for crisis intervention. Okay, so again, I reiterated at the end with the 7-stage crisis intervention model because I think that can be used at all times in a crisis intervention: to plan and conduct assessment, the lethality assessment, establish a relationship, identify the problem, deal with feelings and emotions by active listening and validation, explore and come up with some alternatives, develop an action plan, and establish and follow up a plan. And then that's going to be the end. And references are there. And if you've got any questions, I wanted to tell you what we chose to do in our intervention model. So immediately with that situation with the uncle, because he was pulling on my heartstrings kind of. And anyway, so I call and I have him talk to a partner, and they listen to him. And so that's a situation there where it was tailored to that person. And so we decided on that Easter day to take that chance and bring the person in. And so it just depends. Usually the people that come to us, by the time they get to us and they're looking to come into our program, if they're not ordered by the court, they're completely broken and they're ready for a change. And so that's what we look for when we do a crisis intervention or we do an interview. And so a lot of the times these crisis interventions are a great time to get the person to want to change and to want something different, because they're at a very malleable stage in their life, susceptible to change, and especially if it's positive and motivational. And so anyways, everybody treats things differently. There's a lot of different models out there, and I don't even know, I didn't even see a lot of information, or I want to say journal articles or tests or validations are using these intervention models. I would think that there would be a lot more out there, but I think that when it comes to substance abuse counselors and people kind of go with the field model and go with their experience and what they feel with the person, and I think that's where you really make a big difference. So I hope this has taught you something. If you have any questions, you can comment and I will try to get the answer for you.